Seniors, what if your nighttime struggles with diabetes were the hidden health warnings that decide how long you'll truly live? You know the feeling, waking up tired, running to the bathroom, tossing and turning, heart racing in the dark. It's exhausting. And it's not just aging. It's not just part of getting old. These are signals from your body, signs that your blood sugar is out of control while you're supposed to be resting. When sleep is broken, your heart, your kidneys, even your brain are paying the price. That's why so many seniors feel drained, anxious, or afraid of the night. But here's the good news: once you know what these signs really mean, you can act early. You can protect your independence, wake up refreshed, and feel safe in your own body again. It is possible to enjoy your nights, not fear them. In today's video, I'll reveal the top 15 dangerous nighttime diabetes symptoms seniors must know, straightforward, practical, and life-saving. And trust me, the last one on the list will surprise you. It's a warning most doctors never mention, but it can change everything. So let's dive in, one sign at a time, and uncover the truth your nights have been trying to tell you. Symptom 1, frequent urination, nocturia. Waking up 3, 4, even 6 times a night, does that sound familiar? Many seniors brush it off, saying, well, I'm getting older, my bladder isn't the same. But let me tell you, this is not always just aging. It can be a flashing red light from diabetes. Here's what happens inside your body: when blood sugar runs too high, your kidneys step in. They try to protect you by flushing that sugar out. But sugar doesn't leave alone, it drags water with it. The more sugar in your blood, the more fluid you lose. That's why you're up again and again, no matter how little you drink before bed. Now think about the toll. Broken sleep. Feeling drained during the day. And for seniors, every trip in the dark carries the risk of stumbling, of falling, of fractures that can change your independence overnight. This is not just about inconvenience, it's about safety. So what can you do? First, check your glucose before bed. Aim for that safe zone, usually between 90 and 130 milligrams per deciliter. Second, cut back on caffeine or alcohol late in the day, they both push your bladder to work harder. Third, ask your doctor to check kidney function, because frequent urination can be an early sign of damage. And here's the kicker: losing fluids this way leaves your body desperate to replace them. That's why the next symptom hits even harder. But the dehydration from all that urination creates its own chain reaction. Symptoms 2, excessive night thirst and dry mouth. Picture this: you just got back in bed after another bathroom trip. Minutes later, your mouth feels like cotton, your tongue sticks, and you're reaching for that glass of water again. Seniors with diabetes know this routine too well. But here's the truth: it's not just thirst. It's your body sounding the alarm. Why does this happen? When blood sugar runs high, water is pulled out of your tissues along with the sugar. Your mouth dries out, your throat begs for moisture, and no matter how much you sip, the thirst keeps coming back. Add in certain medications, and the dryness can be brutal. It's not just uncomfortable, it steals your sleep, it cracks your lips, and it even raises your risk for gum disease and infections. But here's the hopeful part. You can fight back. First, hydrate smart during the day, not late at night. Spread your fluids evenly, small sips, not gulps. Keep sugar-free lozenges by your bedside to soothe that dry mouth without spiking your blood sugar. And ask your doctor if any meds are making things worse. Sometimes a simple adjustment makes a world of difference. Ignore it, and thirst at night is more than an inconvenience, it's a sign your health is on the line. And when your body loses this much balance, the next symptom shows up in a surprising way: through the sweat pouring off your skin at night. Symptoms 3, night sweats. Ever woken up with your pajamas soaked, sheets damp, and you wonder, did I leave the heater on? Seniors often blame age, menopause, or just a warm room. But if you're living with diabetes, these night sweats can be a dangerous clue your health is slipping out of balance. What's happening inside? Sometimes, your blood sugar dips too low during the night. Your body panics. Stress hormones like adrenaline surge, pushing your heart to race and your sweat glands into overdrive. Other times, high blood sugar and nerve damage confuse your system, so it sends out sweat signals even when it's cool. Either way, it's not just sweat, it's a red flag. And the cost? Broken sleep. Feeling drained, anxious, and restless the next day. Seniors tell me they wake up chilled, heart pounding, afraid to fall back asleep. This is not just uncomfortable, it's your body telling you the balance of sugar, nerves, and circulation is in danger. So how do you fight back? Check your blood sugar before bedtime, aim for that safe 90 to 130 range. Keep a light snack with protein and slow carbs if you're prone to lows. Make your bedroom cool, between 65 and 70 degrees, and avoid alcohol at night. And if night sweats keep repeating, ask your doctor about continuous glucose monitoring, because knowing when the drops or spikes happen could save you. And here's the twist, sometimes instead of sweat, the night steals your peace through stabbing pain in your legs. Symptoms 4, leg cramps. It's midnight. You're finally drifting off to sleep when suddenly, bam, a sharp pain grabs your calf. You jump, you twist, you rub, but the muscle won't let go. Seniors living with diabetes know these cramps all too well. They're not just an age thing. They're a message about your health. Why do they strike at night? When blood sugar runs high or stays unstable, it drains your body of key minerals, magnesium, potassium, calcium. Without them, muscles misfire, squeezing into painful spasms. Add poor circulation from diabetes, and your legs become battlegrounds every time you try to rest. The toll is real. Lost sleep, next day fatigue, and that creeping fear, what if it happens again? Some seniors even avoid lying down flat, just to escape the pain. But avoiding rest steals energy, steals joy, steals life. Here's the hopeful part. You can fight back. Stretch your calves before bed. Keep your body hydrated through the day, not just at night. Load your plate with magnesium-rich foods like spinach, almonds, avocado. If cramps keep coming, ask your doctor about a magnesium glycinate supplement, gentle on the stomach, powerful for muscles. And don't ignore circulation. Gentle walking or ankle rotations before bed can make all the difference. Leg cramps are painful, yes. But they're also a clue. And if your legs can't find peace at night, sometimes it's because they just can't stay still. Symptoms 5, restless leg syndrome, RLS. Imagine lying in bed, ready for sleep, but your legs refuse to cooperate. They tingle, they crawl, they buzz inside like tiny insects moving under the skin. You shift, you kick, you can't stay still. For a senior living with diabetes, this isn't just nerves. It's a restless body crying out for balance. Here's the truth, RLS often comes from damaged nerves and low dopamine levels, both linked to diabetes. Poor circulation and iron deficiency can make the problem worse. And when it hits at night, it steals your rest, your peace, and sometimes your sanity. Seniors tell me it feels like their legs have a mind of their own, moving until exhaustion wins. But you don't have to accept it as normal. There are practical steps. A short evening walk, or gentle stretches before bed, can calm the nerves. A warm bath or heating pad relaxes the muscles. Foods rich in magnesium and iron, like leafy greens, beans, and lean beef, help replenish what the body lacks. And here's a tip, limit caffeine and nicotine, especially in the evening, because both can turn mild RLS into an all-night battle. Restless legs may sound harmless, but the cost is real, broken sleep, tired days, and higher health risks from constant fatigue. And when the nerves are pushed too far, the pain doesn't just crawl, it burns. Symptoms 6, peripheral neuropathy pain, burning feet at night. You slip under the covers, hoping for rest. But instead of comfort, your feet feel like they're on fire. The burning, the stabbing, the pins and needles, night after night. For a senior with diabetes, this isn't just discomfort. It's nerve damage talking. Peripheral neuropathy happens when years of high blood sugar slowly injure the nerves, especially in the feet. Those nerves that should send gentle signals of touch and warmth now misfire, sending pain, burning, or electric shocks instead. The cruel part? These symptoms flare at night, right when you need your body to be calm. The impact goes beyond lost sleep. Constant pain erodes confidence. Seniors tell me they fear walking barefoot, they dread small injuries, they feel trapped in their own body. And ignoring it? That can lead to ulcers, infections, and even amputations. But here's the path forward. Daily foot checks, yes, every single night. Keep your skin clean, dry, and protected. Wear soft, cushioned socks to reduce irritation. Nutrients like alpha-lipoic acid and B vitamins may help support nerve health. And don't wait, talk to your doctor about therapies or medications designed to calm nerve pain. Burning feet at night are not something to endure in silence. They're a warning, and they're a chance to act. And when nerves cry out, sometimes even your breathing begins to betray you. Symptom 7, sleep apnea and loud snoring. Your partner nudges you in the middle of the night, you stopped breathing again. Or maybe you wake up gasping, heart pounding, not sure why. For a senior living with diabetes, loud snoring and sudden pauses in breath are more than just a bedtime annoyance. They're a silent threat to your health. Here's what's really happening. Sleep apnea means your airway collapses for seconds at a time. Oxygen levels drop. Your heart strains. Your blood sugar spikes and crashes. Diabetes makes this cycle worse, extra weight, insulin resistance, and nerve changes all increase the risk. It's a double burden, the disease and the broken sleep feeding each other. And the cost? Morning headaches. Foggy memory. Daytime fatigue so strong you fear falling asleep in a chair. Over time, untreated apnea triples your risk of heart attack or stroke. Many seniors shrug it off as just snoring. But it's far more dangerous than that. What can you do? Lose even a little weight, 5 to 10 pounds can ease pressure on the airway. Avoid alcohol or sedatives before bed. Sleep on your side, not your back. And ask your doctor about a sleep study. If CPAP therapy is recommended, it can transform your nights and protect your life. When breathing breaks at night, so does your rest. And when sugar levels dip too low, another nighttime danger appears suddenly, jolting you awake. Symptoms 8, nighttime hypoglycemia, low blood sugar episodes. It's 2 in the morning. You jolt awake, sweating, trembling, heart racing like you just ran a mile. Your sheets are damp, your hands won't stop shaking. Seniors with diabetes often brush this off as a bad dream. But this isn't just a nightmare. This is low blood sugar in the middle of the night, and it can be life-threatening. Here's what happens. Maybe you took your insulin but skipped that bedtime snack. Or maybe your medication worked a little too well. As glucose drops, your body sounds the alarm, adrenaline surges, pulse speeds up, sweat pours out. If it keeps falling, confusion sets in. And if it goes too far, seizures or even unconsciousness can follow. The toll is frightening. Seniors tell me they're scared to fall asleep, worried they won't wake up. That kind of fear robs you of peace and eats away at your health. But there is a way forward. Practical steps: always check your glucose before bed, aim for that steady 90 to 130 range. Keep a small snack of protein and slow carbs nearby, like peanut butter on whole grain crackers. Avoid alcohol at night, it can mask the symptoms and make lows worse. And for many seniors, a continuous glucose monitor with alarms is a real lifesaver. Nighttime hypoglycemia is a warning you can't ignore. And once your sleep is broken this way, another problem creeps in: you may find you can't fall back asleep at all. Symptoms 9, insomnia and difficulty falling asleep. You turn off the light, close your eyes, and wait. Minutes pass. Then an hour. Still awake. For a senior living with diabetes, this isn't just getting older. It's a signal that your health and your blood sugar may be out of sync. Why does diabetes steal your sleep? Blood sugar swings, too high, too low, push stress hormones like cortisol into overdrive. That's why your mind races even when your body begs for rest. Add in nerve tingling, frequent trips to the bathroom, or thirst, and sleep feels like a stranger. The cost is bigger than a tired morning. Night after night of insomnia chips away at memory, mood, and even blood sugar control itself. Studies show poor sleep actually increases insulin resistance, making diabetes harder to manage. It's a vicious cycle. But you're not powerless. Set a rhythm, go to bed and wake up at the same time every day. Keep the bedroom cool and dark. Power down phones and TVs an hour before sleep, they keep your brain wired. Choose a light evening snack with complex carbs and protein to steady glucose through the night. And if worries keep you awake, try a short routine of deep breathing or prayer, simple steps that calm both body and mind. Insomnia isn't harmless. It's a sign your nights, and your blood sugar, need attention. And when sleep is broken, digestion often rebels too, bringing another hidden warning. Symptoms 10, acid reflux, GERD, at night. You lie down, close your eyes, and suddenly, there it is. That sour taste rising in your throat. The burning in your chest. You cough, you sit up, you wonder why it keeps happening. For a senior with diabetes, nighttime acid reflux is more than a nuisance. It's a warning that your health is being tested. Here's why. Diabetes can damage the nerves that control your stomach. Food stays longer than it should, pressure builds, and stomach acid sneaks back up into the esophagus. Lying flat makes it worse, and the result is that familiar fire, heartburn, choking, or waking up gasping. And the impact doesn't stop at discomfort. Repeated reflux damages the esophagus, raises cancer risk, and disrupts blood sugar management. Seniors often say they wake feeling sore, drained, even afraid to eat dinner at all. That's no way to live. The good news? You can take back control. Eat your last meal at least 2 to 3 hours before bed. Choose lighter dinners, grilled fish, steamed veggies, rather than heavy, greasy foods. Prop up the head of your bed or sleep on your left side to reduce reflux. Cut out late-night triggers like coffee, chocolate, spicy sauces, and alcohol. Ignoring reflux at night means ignoring a dangerous signal. And sometimes, the disturbed sleep it causes leads to something even stranger, nightmares so vivid they feel real. Symptoms 11, nightmares and vivid dreams. You drift off at last, only to be jolted awake by a dream so real you can still feel your heart pounding. A nightmare where you're running, falling, or gasping for breath. Seniors with diabetes often tell me, "Doc, these dreams feel too real." And they're right. This isn't random, it's your health sending a message. What's happening? When blood sugar drops too low, or spikes too high, your brain gets overstimulated during REM sleep, the stage where dreams are most intense. Instead of calm, your nervous system fires signals of fear and panic. Add in sleep apnea or restless legs, and your brain never finds true rest. The result, nightmares that shake you, vivid dreams that drain you. The toll is heavy. You wake up exhausted, anxious, and sometimes afraid to go back to sleep. For a senior already fighting fatigue, that's a cruel cycle. And worse, these episodes often mean your glucose swings are more serious than you realize. But there is hope. Keep your blood sugar steady with a balanced evening snack, something with protein and complex carbs. Build a calming bedtime ritual, soft music, reading, or prayer. And track patterns, notice if nightmares happen after heavy dinners, skipped meals, or late sweets. Nightmares are more than scary stories in your head. They're early warnings from your body. And when your body's alarms go unchecked, even your blood pressure can begin to rise while you sleep. Symptoms 12. High blood pressure spikes at night. Your head hits the pillow, you expect your body to rest. But here's the truth, for many seniors with diabetes, blood pressure does the opposite. Instead of dipping down like it should, it climbs. Quietly. Invisibly. And that hidden rise can be one of the most dangerous threats to your health. Why does it happen? Normally, blood pressure lowers at night to give the heart and vessels a break. But diabetes changes the system. Damaged nerves, stiff blood vessels, and cortisol surges keep pressure high, or even push it higher. You won't always feel it. Sometimes the only clues are morning headaches, restless sleep, or waking up short of breath. The danger is real. Nighttime spikes double the risk of heart attack, stroke, and kidney failure. Seniors often say, "But my pressure was fine at the doctor's office." That's because the spikes happen while you sleep, hidden from routine checks. Here's what you can do. Ask about a 24-hour blood pressure monitor, it records the truth while you rest. Cut salt and processed foods, especially at dinner. Keep alcohol out of your evenings. And build in gentle activity during the day to ease pressure at night. Ignoring these spikes is like ignoring a ticking clock. And when pressure surges, your heart often lets you know, in the middle of the night, beating faster than you can explain. Symptoms 13, palpitations or racing heartbeat. It's the middle of the night. You wake up suddenly, chest pounding, heart racing so fast you can hear it in your ears. Scary, isn't it? For a senior living with diabetes, this isn't just anxiety or a bad dream. It's a red flag that your health is under pressure. Why does it happen? Blood sugar swings can throw off the balance of key minerals, potassium, magnesium, sodium. When that balance is lost, your heart's electrical system misfires. The result, palpitations, skipped beats, or a racing pulse. Add in the stress hormones that spike with highs or lows, and your heart feels like it's running a marathon while you're lying still. The cost is more than fear. Nighttime palpitations rob you of sleep, leave you drained by morning, and in some cases signal a deeper problem, atrial fibrillation. That's a rhythm disorder strongly linked to stroke, especially dangerous for seniors with diabetes. But here's what you can do. Focus on steady glucose before bed. Eat potassium-rich foods like avocado or spinach. Keep magnesium on your plate, nuts, seeds, leafy greens. Stay away from late caffeine or alcohol, which both push the heart harder at night. And don't ignore repeated episodes, get your doctor to check your rhythm with an EKG or monitor. Your heart's night rhythm matters. And when it's pushed too far, even your jaw muscles may reveal the hidden strain. Symptoms 14, teeth grinding, bruxism. You wake up with a sore jaw, maybe even a headache that lingers through breakfast. Your partner might say, "You were grinding your teeth all night." For a senior managing diabetes, this isn't just a quirky habit. It's another nighttime clue that your health needs attention. So why does it happen? When blood sugar dips too low, or when stress hormones rise from unstable glucose, your body tenses. That tension doesn't stop at your chest or your nerves, it hits your jaw. Muscles clamp down, teeth grind, and hours later you're left with pain, worn enamel, or even cracked fillings. Over time, this constant grinding can damage the jaw joint itself, leading to chronic pain every morning. The impact goes beyond the mouth. Seniors with diabetes already face higher risks of dental issues, gum disease, infections, delayed healing. Bruxism piles on more trouble, making small problems much bigger. But there are ways forward. A calming bedtime routine, deep breathing, prayer, or reading, can ease tension before sleep. Ask your dentist about a night guard to protect your teeth. And most importantly, keep your blood sugar steady before bed. Stable glucose means fewer stress surges, and fewer nights of grinding. Grinding may happen in silence, but the consequences speak loud. And sometimes, the first sign greets you not in the night, but the moment you wake, with a pounding headache that refuses to be ignored. Symptoms 15, morning headaches after poor night's sleep. The alarm goes off, the sun is up, but instead of feeling rested, you sit on the edge of the bed holding your head. That heavy, throbbing ache greets you before the day even begins. For a senior living with diabetes, morning headaches are not just part of getting older. They're a sign your health was under stress all night long. Why do they strike? Unstable blood sugar, too high, too low, triggers changes in blood flow to the brain. Add in dehydration from frequent urination, or hidden sleep apnea that starves the brain of oxygen, and the result is a pounding headache before breakfast. Some seniors also lose key minerals overnight, making the pain sharper, the fog thicker. The impact is draining. You start your day exhausted, irritable, and less steady on your feet. For someone already managing diabetes, that means higher risks, slips, poor focus, even weaker glucose control as stress hormones surge. But here's the hopeful side. Drink enough water during the day, not just at night. Keep your blood sugar steady before bed. If headaches are frequent, ask your doctor to check for sleep apnea or nighttime blood pressure spikes. Even simple steps, stretching, breathing, or a lighter evening meal, can reduce the morning pain. Morning headaches aren't random. They're the final whisper from the night, reminding you that diabetes speaks loudly when the world is quiet. The good news? Once you recognize the signs, you can take back your nights, and your mornings. So, after hearing these 15 nighttime warnings, you might be thinking, "Doc, what do I do now?" Here's the encouraging truth: change doesn't have to be overwhelming. First, pay attention. Write down what happens at night, the trips to the bathroom, the thirst, the sweats, the racing heartbeat. When seniors track patterns, the puzzle becomes clear. Second, check your numbers. A simple blood sugar test before bed, or a continuous glucose monitor, tells you where you stand. Stable numbers at night mean deeper rest and safer mornings. Third, make your evenings work for you. Choose lighter meals, stay hydrated through the day, keep caffeine and alcohol away from bedtime. Gentle movement in the afternoon, a calm routine at night, these small choices protect your health more than you realize. And most importantly, don't walk this road alone. Talk to your doctor. Share your notes. Ask about sleep studies, kidney checks, or medication adjustments. Knowledge plus action, that's how seniors win back their nights. We've covered the 15 dangerous nighttime diabetes symptoms every senior must know. Each one is a signal, a chance to act before complications strike. If this video gave you clarity, share it with another senior who may be struggling in silence. Leave a comment, I'd love to hear which symptom spoke to you most. And don't forget to subscribe for more life-saving health wisdom. And if you're ready to go deeper, check out the next video in our playlist. It reveals hidden daytime diabetes signs that most people overlook. That knowledge could save you or someone you love. Because your nights should bring peace, not fear. And together, we can make that a reality.